The healthcare overhaul, meanwhile, is officially underway, and a new bureaucracy apparently born. Did you hear this? It's called the Office of Consumer Information and Insurance Oversight. So obviously they're printing out the stationery. It's already got 4 offices beneath it. Alabama Congressman Dr. Griffith says this is a bureaucratic nightmare and it's just beginning. Now, you might recall the good congressman was the one who switched from being a Democrat to a Republican in the height of this health care debate. So, Congressman, what do you think of, well, at least we're getting grids together, I guess.
Well, Neil, I believe that anyone who's had to deal with the VA system, the Medicare system, Social Security knows what's coming. I think it's going to harm the very people it was intended to help. I think the bureaucracies are numbered in the hundreds, and navigating those bureaucracies are really not going to be difficult for the very wealthy and the near wealthy, but it's going to be very difficult for the average man on the street.
But Congressman, I'm more concerned about, you know, normally you talk to any veteran going through the Veteran Affairs agency, and you know, you layer and layer various agencies, it slows down the response. I know the hope with this is just the opposite will happen, but the history suggests, in your fine city there behind you, anything but.
Well, it's not going to help health care. We know that. We know it's not going to reduce cost. We know it wasn't about reforming health care or increasing the average American's ability to get access to health care. We know we can't reform a system around a shortage. We know that we're getting ready to create a 2-tier system. We're going to have about 20% of America that's going to access the health care they need, and the other 80% are going to do the best they can with a layered bureaucracy having to go to Washington for decisions.
But Congressman, do you know, I know when they build, you know, these charts and staffing type arrangements, I always think of new buildings. And I'm wondering if this is going to be this Consumer Information Insurance Oversight. Is it going to have its own building? Because I was just in Washington recently. You're running out of space. Where would you put it?
Well, they'll find a place to put it, Neil. I'll tell you, if after 2 or 3 years they'll want a new building and they'll get a new building, it'll be a huge new entitlement with thousands of new bureaucrats. And of course, for every bureaucrat, we need at least 5 or 6 attorneys. And so this is going to be a huge entitlement program, not only for the legal profession, but also for the bureaucrats that are running this huge healthcare system.
Thank you, Congressman. Good seeing you again.
Thank you. Appreciate you.
Meanwhile,